Hello, I'm Dr. Joe Cobb at Colbert Animal Clinic in Tuscumbia, Alabama, and today I'd like to talk to you about pancreatitis. Now, a lot of people probably never heard of that, or some people may have heard even more about it than they want to, and it's quite a mystery to many people. Now, pancreatitis is basically an inflammation of the pancreas gland in the abdominal cavity. And what the pancreas does, which many people are probably aware of, is it produces insulin, which regulates the glucose levels in the bloodstream. But the pancreas also produces a couple of other enzymes that are very important, lipase and amylase, which are used to digest and dissolve fats and starches and carbohydrates and so forth. And that's what gives us the problem when we're dealing with pancreatitis. Pancreatitis is an inflammation of the pancreas. Anytime you hear a word with the suffix itis, itis, it means inflammation. And that's what we have in pancreatitis. The pancreas is inflamed. And what happens is quite often those enzymes, the lipase and amylase, will be cut loose, and instead of getting into the digestive tract like they're supposed to, they'll actually wind up in the bloodstream and can cause quite a few problems. Typically with pancreatitis in dogs, we see it in older, overweight, spayed females. That's not 100%, however. I tell people that any animal with a pancreas can get pancreatitis. We used to think that it was more common in overweight animals, and it probably still is, but we've seen quite a few animals that are normal weight that get it. The cause is unknown. There are some things that we know does cause it, but not necessarily 100% in each case. Again, as I say, being overweight, having a lot of lipids, in other words, fat in the bloodstream, can add to it or cause it. A high-fat diet can cause it. Those of you who like to give your dogs treats of ice cream and cheese and so forth, you might have some problems there. But anyway, some medications have been known to cause it. A lot of times it's just bad luck. Occasionally an intestinal infection may cause it because the pancreas has a little duct that carries the enzymes down into the intestinal tract, and if that gets inflamed or irritated or infected, then the bacteria can crawl back up through that duct and get into the pancreas and cause problems. Now, the most common symptoms in dogs are basically vomiting and diarrhea. Typically, you will see a dog that, like I say, an older, middle-aged dog, whatever, start developing vomiting quite a bit. Very often they will have bloody diarrhea, and first thing people think of is, oh my Lord, they've got parvo. But yet it's an older adult dog that's not likely to have parvo. Those are not 100%. We see vomiting more than we do the diarrhea, and we've had some cases lately where we don't see the diarrhea like we used to. Typically the animal will run a fever. One of the more common signs is they will be very tender in their abdomen. You try to touch their abdomen and you can just feel them tense up. Sometimes they even walk bowed over, and people think they've got a back problem, but it's actually the pancreatitis. Acute pancreatitis, in other words, sudden onset, that's an emergency. You don't need to wait 2 or 3 days and see if they get over it. If they are allowed to continue with that, the situation can get much worse. Permanent damage can be done. You could end up with a dead animal. The treatment typically will consist of IV fluids. We've got to keep that system flushed out, keep their system going, correct the imbalances that are due to the vomiting and diarrhea. They're losing nutrients, they're losing electrolytes, they're losing fluids through those. We'll typically protect them with antibiotics because, again, the pancreas is so close to the intestinal tract. Any damage can cause bacteria to get up into the pancreas, and then you've got more problems. Give them antiemetics, in other words, something to try to control the vomiting. Pain relief, because this is a painful condition. Occasionally, if they're not vomiting that much, we will allow people to go, or we'll use it ourselves in either case, oral supplementation of some sort of electrolyte solution like Pedialyte or even Gatorade sometimes. Typically does require hospitalization. If we get to them fast enough and treat them aggressively enough, they generally recover. Some animals will have a relapse. Some will just have a chronic pancreatitis. In other words, their pancreas is always just kind of on the borderline, and the least little thing, they will flare up. We've got a couple of cases, a couple of patients of our own, in our practice that they're constantly having trouble. Right now they're on a supplement, pancreatic enzymes that they take prior to eating to kind of take the load off the pancreas and sort of do the job of the pancreas so that it's not constantly working and getting overworked or stressed, however you want to call it. When I was in veterinary school, we were told that pancreatitis did not occur in cats, and we have found, like a lot of things, that that wasn't true. That cats can in fact get pancreatitis. It's a little harder to diagnose in cats than it is in dogs, because typically it's not necessarily vomiting and diarrhea. It's just a cat that's just feeling pretty yucky. And what we try to do is rule out other things, because obviously other things can cause a cat to feel yucky. We like to call the situation the cat is ADR, ain't doing right. So what we do is a good thorough exam, see if what we can find, perhaps blood work. In the case of dogs and cats, now we have a very good tool that we can use in our clinic, what they call an in-house pancreatic enzyme test. It's specific for dogs, and another one specific for cats. It's very good, gives us a pretty good idea if that is in fact what we're dealing with. Used to, what we would do is just regular blood work, and in dogs we would look to see if we had a very high lipase, something like that. Wasn't that accurate. Now we have the pancreatitis test, much more accurate, not 100%, but it's close enough that if we get a positive, we feel pretty comfortable that that is in fact what we're dealing with. That allows us to get started with the proper treatment immediately. In cats, again, just as in dogs, we're not sure what the cause is. It's just one of those things that occur, but we typically treat it pretty much the same way: fluids, antiemetics, antibiotics, so forth. We haven't treated a lot of cases here, but for the most part they've done fairly well. So again, get to it fast, don't dawdle around, get your animal somewhere, get the diagnosis and get them treated. In chronic cases, typically what we do, as I said before with the two dogs, we will put them on either a prescription diet, products such as the Hill's ID intestinal diet or Purina EN for enteric diet. Those are prescription dog and cat foods that are made to be used in these situations. They contain proper levels of fat and so forth that will not aggravate the pancreas, but yet still provide adequate nutrition. Some people who their animals are not that bad or just will not eat those foods will put on the pancreatic enzyme supplements, and those come in either a powder or a tablet. Most veterinarians feel that the powder is actually a little better than tablets, but we've had success with both. And typically what's involved is you give it to the animal at the time of feeding. Anytime they eat, you must give it. We always tell the people, if you're not going to use the prescription dog foods, you're going to use this other, you still have to be careful about what you feed them. Again, you don't want to give them you know, the ice cream, the cheese, and all those kind of things. It's like a cardiologist said one time, if you want to know if a good food is good for you or bad for you, go by how it tastes. If it tastes bad, it's good for you. If it tastes good, it's bad for you. Sometimes you can say the same thing about dogs and cats. But we typically, you know, you would think that with pancreatitis that you might get diabetes as a complication of that due to the damage to the pancreas. So far, we have not seen that much trouble. We haven't seen the insulin production be affected. We have maybe 1 or 2 times, but for the most part, the two problems are completely different. And I think only once or twice have we actually had a dog to develop diabetes that had chronic pancreatitis. But it still bears watching, and it's something, if the dog has repeated incidences of pancreatitis, you need to really be diligent about watching them. So that's it on pancreatitis. It's not a unknown problem. It's not a rare problem. We see probably a case or 2 every month. Actually, I think we're seeing more cases than we used to. I don't know why that is, if animals are just getting fed more, if there's some other factor. Just like, as I said, can be related to obesity, age, and diet. And of course, we know that a lot of human problems have the same relationship. So it may be as our pet population is getting older and fatter, like we are, then that's a problem that they're going to have to deal with. But again, get to it in time. If you're in doubt, you've got a vomiting dog or just a sack cat that's just not doing well, don't wait around. It can be a matter of life and death. And if you have any questions, feel free to call us at 256-381-6210. Thank you. Have a good day.